ADHD affects how motivation and emotions are regulated in the nervous system. Dopamine and serotonin play key roles in how energy is activated and how the system recovers. This video explores these patterns through a nervous system-informed lens. ADHD shapes how energy, focus, and emotions move through the body. This is not only a cognitive experience, it reflects how the nervous system initiates action, sustains effort, and returns to baseline. The two primary systems that guide regulation are dopamine and serotonin. Dopamine supports activation and engagement. Serotonin supports emotional steadiness and recovery. Both systems work together to support regulation. In a more regulated or neurotypical nervous system, dopamine supports starting tasks with less effort. Effort is easier to sustain. Motivation and reward are closely linked to anticipation. Action is fueled before effort is required. In a more regulated or neurotypical nervous system, serotonin supports emotional steadiness and flexibility. Emotions rise and fall without remaining activated. The nervous system returns to baseline easily after stress. With ADHD, dopamine activation is often delayed or inconsistent. Getting started requires more energy. Effort may drop quickly. Motivation often arrives after action rather than before. This reflects regulation differences, not lack of effort. With ADHD, serotonin regulation can be slower. Emotions may escalate quickly and take longer to settle. The nervous system can remain activated after the situation has passed. Strong emotions reflect delayed recovery, not emotional excess. In a more regulated system, starting feels easier, effort is more linear, and emotions resolve. In an ADHD nervous system, starting takes energy, efforts fluctuate, and emotions linger. These are regulation patterns, not personality traits. In ADHD, initiation can be difficult and emotional activation may not settle quickly. The nervous system stays on. The body remains mobilized. The brain continues scanning. Rest and recovery are delayed. Common ADHD regulation responses may appear as pre-activation overload before starting. Rumination as the system seeks resolution. Shutdown or avoidance as protection. All or nothing thinking when flexibility decreases under stress. Remember, these are not personality traits, they're regulation patterns. They describe how the nervous system responds to activation, stress, and recovery. Understanding this reduces shame and increases compassion. This framework comes from my trauma-informed, nervous system-based clinical training and ongoing work with neurodivergent individuals and couples. If we understand how the brain and nervous system function, it changes how support is offered, and it's more towards regulation rather than pressure. For additional insight, practical tools, or recommendations on videos related to ADHD and nervous system regulation, feel free to reach out and follow for more content.